In the Philippines, a significant number of children still suffer from preventable diseases. The number of children getting sick can be reduced through the simple act of washing their hands with soap. And yet, many still fall ill due to poor hygiene practices. While there have been efforts to improve access to hand-washing facilities and increasing knowledge of proper hygiene practices, IDinsight's research showed that hand-washing rates remained lower than 12%. It wasn't the lack of facilities nor knowledge. The problem had a much deeper cause: habits. So, how can we help school children develop the habit of hand-washing? IDinsight, in partnership with UNICEF, the Philippines Department of Education, and the Wash Pals project funded by USAID, developed a package of nudges, or simple changes to the environment designed to trigger hand-washing after toilet use. These nudges were found to be effective in increasing hand-washing rates in other environments like hospitals and workplaces. We created 3 sets of nudges to be tested in 99 public primary schools located in Zamboanga del Norte. Our first nudge was based on IDinsight research on hand-washing among students in the Philippines. It showed that when asked why they did not wash their hands, the most common reasons were, "I forgot," or "I was in a hurry." Our solution: the addition of simple, visual posters behind the toilet stall door. IDinsight also observed that in many of the schools they visited, the toilet area was often several steps away from the hand-washing area. To visually encourage students to make the trip, we installed a brightly colored footpath leading from the toilet to the sink. Lastly, we observed that people use hand-washing spaces for multiple purposes: for drinking water, cooking, or brushing their teeth. So how do we make hand-washing more prominent in this list of activities? By adding visual cues in the form of an arrow pointing towards the soap dish and a pair of watchful eyes. So, were the nudges effective in increasing hand-washing rates? To answer this, we conducted a cluster randomized control trial with a treatment group, or all schools in the study in which we installed nudges, and a control group, schools in which no nudges were installed. We made sure the schools had adequate hand-washing facilities, including readily available water, at least some days. We then collected hand-washing rates from both groups 4 months after installing the nudges, and compared the difference. To ensure objectivity, surveyors were also sent to directly observe students' behaviors, rather than relying on data self-reported by the students. The results? Nudges improved student hand-washing rates, which more than doubled in the treatment group. At a cost of less than $70 per school, the Department of Education now has the evidence to make the decision to scale up school-based nudges in suitable elementary schools in the Philippines as part of its Wash in Schools policy.